Everyone seems to be searching for a fast solution. People often ask, how can I raise my testosterone quickly? Or, what can help me get stronger, longer-lasting erections? Today we're going to look at one of those so-called quick fixes and explore the research behind a supplement known as Tongkat. Is this the miracle product that will make you stronger and improve performance? Stay with me and we'll find out. I'm Dr. Rena, a urologist and pelvic surgeon, and today we're discussing Tongkat, especially how it may affect erectile dysfunction, testosterone levels, and even stress. How exactly does this supplement influence these areas, and what does the science actually show? Let's dive in. Tongkat mainly comes from the forests of Malaysia, and it belongs to a plant family called Eurycoma longifolia. This plant has long been known for properties believed to act as aphrodisiacs, meaning they may increase sexual desire. Over time, it has been promoted for a wide range of potential benefits, including improved erections, higher testosterone levels, support for fertility, and many other claims. Before we talk about whether this supplement might help you, I want to be very clear about something. This is not a magic cure. If you're overweight, eating poorly, or not getting enough sleep, no supplement will fix those problems for you. You still need to focus on regular exercise, maintaining a healthy weight, and getting at least 7 hours of sleep every night so your body can naturally support healthy testosterone levels. If you'd like to learn more about that, take a look at my video on how to naturally increase your testosterone. If you decide to look for Tongkat as a supplement, the form you should be paying attention to is the hot water root extract. The reason is that this version has been shown to be very safe even at higher doses. And it's considered bioavailable, meaning your body can actually absorb and use it effectively. Another interesting point is that it has a very strong bitter taste. So if you purchase a Tongkat supplement and it doesn't taste bitter at all, there's a good chance it doesn't contain the proper amount needed to be effective. Now, let's begin with erectile dysfunction. What does the research say? There have been 2 major studies examining erectile function in men who used Tongkat. Researchers divided participants into 8 different groups and followed them over varying periods of time. Generally speaking, the participants were healthy men between 35 and 60 years old. They were given either 200 milligrams of Tongkat per day or 300 milligrams per day, taken either once daily or split into 2 doses. So, how did the researchers measure the results? They used several well-validated questionnaires. What that means is these are carefully tested surveys that researchers rely on to accurately help people report and identify changes in their sexual health and function. If a patient was experiencing erectile dysfunction according to the scoring system, researchers also tracked how often they attempted intercourse. Participants kept a diary of these attempts. They also evaluated the firmness of the erections and asked detailed questions about that as well. So, what did the researchers discover? Overall, they did not find a statistically significant difference between men taking Tongkat and those taking a placebo pill, which is basically a sugar pill. However, in the group of men who had more severe erectile dysfunction, there did appear to be a small amount of improvement. This suggests that men with more serious erectile issues might notice some benefit. Importantly, the study also reported no harmful side effects from the supplement in this group of participants. So, what's the bottom line? Based on the studies so far, Tongkat hasn't clearly been shown to improve erections. But what about testosterone? And how does it actually affect testosterone levels? It doesn't work the same way as testosterone replacement therapy. You're not simply adding testosterone directly into your body. Instead, it helps release testosterone that is already in your system. Normally, a portion of testosterone is attached to something called sex hormone-binding globulin. Tongkat may help free that testosterone, so more of it becomes available for your body's tissues to use. This matters because testosterone plays a role in many functions, including sexual desire, muscle mass, mental sharpness, and several other important processes in the body. There's also another theory about how Tongkat Ali works. It may slow down the breakdown of testosterone. Normally, your body uses testosterone and then gradually metabolizes or clears it from your system. This supplement may help prevent it from being broken down too quickly, allowing it to stay active in the body for a longer time. Several studies have looked at this effect. In fact, one research paper reviewed about 5 different studies. The number of participants in those studies varied quite a bit, ranging from as few as 13 people to more than 100 individuals. Across these studies, the results were encouraging. In each case, participants showed a statistically significant increase in their blood testosterone levels. In simple terms, that means the increase was unlikely to have happened by chance, based on the statistical analysis used in the research. So, does Tongkat Ali help increase testosterone? Based on the available studies, it appears that it does. The final topic we'll discuss is infertility. Can Tongkat Ali help with fertility problems? There hasn't been a large amount of research on this yet, but there was one solid study conducted on men who were considered subfertile. These were men who showed abnormal results on a semen analysis. In simple terms, their sperm parameters were below normal. When compared to the typical bell curve of semen results among men, they fell into the lowest 5%. They had low sperm concentration, low motility, which means the sperm were not moving properly in the right direction, and poor morphology, meaning the sperm did not have a normal shape. In this study, 75 men completed the research program. Each of them took 200 milligrams per day of Tongkat Ali, and the treatment continued for as long as 9 months. So what were the results? Researchers found that sperm concentration increased, and that increase was statistically significant. They also observed improvement in sperm morphology, meaning a greater number of sperm appeared normal during follow-up semen tests after the men had taken Tongkat Ali. Now, this was still a relatively small study, but the findings are encouraging. One reason this is especially interesting is that testosterone replacement therapy can actually cause infertility in men. So, for men with low testosterone who are trying to preserve fertility, Tongkat Ali might be a possible option. Of course, the dosage must be correct, and the supplement itself needs to come from a reliable source. The reason for this is that some manufacturers sell products labeled as Tongkat Ali, but include only very small amounts of the actual ingredient. They may fill the rest of the supplement with other substances simply to increase profit. As I've mentioned in other videos, dietary supplements are not strictly regulated. That means there is no guarantee that what's printed on the label is exactly what you're getting inside the capsule. Because of that, it's very important to choose products from trustworthy and reputable companies. Before we wrap up, let's briefly talk about reported side effects of Tongkat Ali. Fortunately, there have only been a few noted so far. These include irritability, trouble sleeping, and a feeling of restlessness. There are also certain people who should not take Tongkat Ali, and this is very important to understand. Since the supplement increases the amount of bioavailable testosterone in your body, anyone who should avoid higher testosterone levels should not use it. This includes men with prostate cancer, individuals with obstructive sleep apnea, and people with breast cancer. In some situations, those with diabetes, heart disease, kidney disease, or individuals with weakened immune systems should also avoid it. If you're thinking about trying this supplement, it's always a good idea to talk with your doctor first. They can help determine whether it's safe for you and make sure it doesn't interfere with any medications you may already be taking. Certain medications may interact with it, so caution is important. And remember, always take good care of yourself, because you truly deserve it.